class, I hope you're working hard doing your chapter exercises and your reviews. Now remember, if you need assistance, I'm just a click or a phone call away. Let's look at what you've been learning in Chapter 4. In Chapter 4, you have started learning about the official guidelines. The official guidelines for coding and reporting were developed and approved by the cooperating parties. And those cooperating parties are the American Hospital Association, the Centers for Medicare and Medicaid Services, and the National Center for Health Statistics. The guidelines can be found in the front of your coding manuals, and you can also find them on the CDC website. The guidelines are arranged in sections. Section 1 is the structure, the conventions, and just the general guidelines. So it gives you the roadmap, what different things mean, as far as the colon, the parentheses, brackets, and then just the general guidelines. Section 2 and 3 deal mostly with inpatient principal diagnosis, but it also has some information about additional diagnoses. Section 4 is the outpatient section, and it has to do with all outpatient coding. Now there are some references in section 2 and 3 regarding outpatient coding. So you may want to make sure that you take a look at those sections as well. Section 1 has the conventions of ICD, and these are just the general rules for using the coding manual and giving you the guidelines. These conventions are incorporated within the Alphabetic Index as well as the tabular list in your ICD, and you'll see those as instructional notes. ICD-10 is divided into your alphabetic listing, which is an alphabetical list of terms and their corresponding codes. We also have a tabular list, which is a chronological list of codes that are divided into chapters based on either a body system or a condition. The alphabetic index consists of the index to diseases and injuries, the neoplasm table, the table of drugs and chemicals, and the index to external causes of injuries. Now I hope you've been tabbing your book and you have these different sections tabbed. It may be the difference between passing or failing a certification exam. You want to be able to move through that book pretty quickly, and if you have your book tabbed appropriately, you will be able to get through that book, find what you need, and answer your question. The level of specificity. The level of specificity is actually the detail in coding, and those details are very important. You have to report the highest number of characters that are available. It can be between 3 and 7 characters. A 3-character code is going to be used only if there is not any further subdivision. A 4, 5, 6, or 7-character code is not found within that level. That's the only time you'll be able to use a 3-character code. If you use a 3-character code, but the code actually is at the 7th character level, that code is going to be rejected by the insurance company. It's not going to be paid. It's going to be sent back to you to rework it. So you want to make sure that you code to the highest level of specificity allowed. Now, do you remember what the maximum number of characters is in an ICD-10 code? If you answered 7 characters, you are correct. When signs or symptoms are due to a diagnosed condition, the signs or the symptoms are not going to be reported separately in outpatient coding. If the signs or the symptoms are not due to the diagnosed condition, then you would code the signs and symptoms for that visit. For example, if a patient came into the clinic with complaints of ear pain and fever, and the physician diagnoses otitis media, what would you report? Otitis media would be the only diagnosis you would report because the fever and the ear pain are all symptoms of otitis media. Now, when the symptoms and the signs are not due to the diagnosed condition, then you are going to code all of that. For example, you have a patient that has pneumonia and dehydration. You would report both conditions, and that's because dehydration is not stated as being due to the pneumonia, and certainly not all patients that get pneumonia become dehydrated. So in this instance, you would code both pneumonia and dehydration. In the index, manifestation codes will be listed together with the etiology coding first, followed by the manifestation code in brackets. The code in brackets, remember, is always sequenced second. When there is not an etiology manifestation combination, but the terms code first and use an additional code are used, then you're going to use the same sequencing guidelines. Let's look at this example. The patient has diabetic retinopathy. Diabetes is the cause of the retinopathy or the etiology, and retinopathy is the manifestation or the symptom. Now, in ICD-10, we have one code that gives us both the manifestation and the etiology, and it's a combination code E10.319, type 1 diabetic retinopathy. Or it could take multiple codes, such as if the patient has staphylococcal aureus cellulitis of the face, there's not a combination code for that. So we're going to code the cellulitis L03.211 and then also code the staphylococcal aureus at B95.61. So you can see etiology and manifestation codes could be one combination code that gives everything you need, such as in the example of diabetic retinopathy, or it could take multiple codes as we saw in this staphylococcal example. Acute and chronic conditions. When acute and chronic conditions both exist and the index contains separate entries for both. You want to use both codes, but you're always going to sequence the acute condition first. We see that with acute on chronic kidney disease. So you would code both conditions, with the acute condition being sequenced first. A combination code is a single code that's used to classify two diagnoses. A diagnosis with an associated secondary manifestation, or a diagnosis with an associated complication. Combination codes are identified by referring to the subterm entries in your alphabetic index and reading the inclusion and the exclusion notes in the tabular list. Remember, we never code directly from the alphabetic index. Multiple coding should not be used when the classification provides a combination code that clearly identifies all elements documented in that diagnosis. If the combination code lacks the necessity in that specificity to describing the manifestation or maybe the complication, then you may have to add an additional code as a secondary code to be able to code that entire statement. And here on the screen is an example of a combination code. K80.00 tells us that the patient has acute cholecystitis with cholelithiasis. Residual and cause. Late effect codes are reported when the acute phase of the illness or the injury has passed, but a residual remains. Sometimes an acute illness or injury will leave the patient with a residual health problem that remains after the illness or injury has resolved. We see that a lot with patients with strokes or fractures. The residual is reported first, and then the late effect code is assigned to indicate the cause of that residual or late effect. And an example would be a patient that maybe has scars, which is the residual after they've had a severe burn. The burn is the cause, but the scars are what is left over or what they're experiencing problems with now. That's the residual. The term sequela means late effect, and you're going to see many codes in ICD-10 that have a seventh character designation of an S, and this identifies the sequela. Now remember, there's no time limit for the development of a residual condition. So it could be right after the code or right after the illness, or it may occur months or years later. Some body parts or organs occur in pairs, for example, your kidneys, femurs, and femoral arteries, just to name a few. Other body parts or organs are singular in physiology, like your bladder, your spine, your heart, and your aorta. Laterality refers to paired organs. Unilateral means that we are going to be coding one side of a pair. Bilateral means we are coding both sides of a pair. In ICD-10, we have an extensive amount of codes that give laterality. So the only difference between M70.841 and M70.842 is that 841 is of the right hand and 842 is of the left hand. So you're going to have to pay really close attention when you're coding for laterality. Let's take a look at the basic steps for coding. We want to make sure that we assign a diagnosis from the alphabetic index using main terms, subterms, and essential modifiers. So we're going to start with our main term, go into our alphabetic index, look at any subterms or essential modifiers that are going to help us direct us to the correct code. Now you want to make sure that you use both the alphabetic index and the tabular list. So you're going to find the code in the alphabetic index, then you're going to flip back to your tabular with that code and read more about it. So it's important that you never code directly from the alphabetic index. You want to make sure that you review your health record. You identify the diagnosis that's going to be coded from the health record. You want to make sure you know the principal diagnosis, or if it's outpatient coding, the first listed diagnosis. That will be the reason that the patient came into the healthcare facility that day. Again, you're identifying your main term, looking it up in your alphabetic index. You're going to review any subterms, and then sometimes you may have to use those cross-references. You might have to see also another term if you can't find what you're looking for there in the first place that you look. Always verify the code that you select in the alphabetic index back in the tabular list. You want to look at any instructional notes there in the tabular list. It may lead you somewhere else. You always want to make sure that you code to the highest level of specificity, and you code the diagnosis until all elements are completely identified and sequenced in accordance with your guidelines. Now let's look a little closer at that alphabetic index. The main terms are usually identified by disease conditions or nouns. They're not usually body parts or sites, so you're going to want to be looking at that noun, the disease condition. Staying with the diagnosis pneumonia that we've been using during these last couple of chapters, let's say that your physician documents Klebsiella pneumonia. So what would be your main term? If you said the noun pneumonia, you are correct. So let's go to our alphabetic index and look up that main term pneumonia. Give you just a few seconds to do that. So once you're there, you're going to want to scroll down and look for any subterm for Klebsiella. Once you find that, you'll see that it's sending you to code J15.0. So your next step is to move back to your tabular list. Read J15.0. Make sure there's not any other instructional notes. And then you're going to assign J15.0. Okay, let's apply what you've been learning about main terms. Remember, the main terms are usually nouns and/or disease conditions. So, what is the main term for gastric upset? Now think about this for a minute. If you said upset, you are correct. Gastric is a subterm, and think about that because gastric is the location. So locations are not the main term. Upset is the main term. Now, if you did go to gastric, it would tell you to see condition, and the condition is upset. And then you'll look up upset and the subterm gastric. Okay, let's look at this next one. Chronic mastoiditis. What is your main term? What are you going to look up in your alphabetic index? If you said mastoiditis, you are correct. What about herpes simplex? What is the condition? The condition is herpes, so that is the main term, and then simplex will be one of your subterms. Everybody doesn't always think exactly the same. So main terms can be found in more than one place. It's most often true when you're looking up an eponym, and remember, an eponym is a disease or a syndrome that's named for a person, either the person who discovered it or maybe a famous person that has that disease. Adjectives and anatomic sites do appear sometimes as main terms, but they will refer the coder to see condition, just like we saw with that gastric upset. The guidelines are going to be your foundation for ICD-10 coding. So you want to make sure that you are familiar with them and that you know where to look them up. Remember, you're going to locate a code in your ICD-10 book by first locating that main term in the alphabetic index that corresponds to the diagnosis or the reason for the visit. Then you're going to flip back to your tabular list to verify that. You're going to read and be guided by any instructional notes that appear in both the index and the tabular list. And remember, it's essential to use both the alphabetic index and the tabular list when locating and assigning a code. I hope this overview has brought this chapter to life for you. If you have any questions or need clarification, please contact me. This is your foundation. Let's make it strong. Now it's going to take practice. You're going to miss some here or there. When you do make a mistake, just go back, look over it, try to find out why you missed it. If you can't figure it out, get in touch with me and I will help you. But I promise you, you will remember that guideline the next time you code from it. Thank you.